prepared, right?
The following segment is sponsored by Utah Facial Plastics.
Chef Bryan and I absolutely love Utah Facial Plastics. We are so excited to have them here today.
I know. Dr. Douglas Henstrom is here with us. He is a board-certified facial plastic surgeon from Utah, and facial plastics with us today. I am thrilled. I know you very well. You have stuck needles into my face.
And we trust you.
And you're a great patient.
Thank you.
Awesome
Thank you. Thank you.
We
It's
love
great
you.
to have you.
So we're talking about you do mini facelifts in office, right?
Yeah. You know, Scott Thompson and I, my partner, we've worked hard to kind of perfect the techniques of mini in-office facelifts. Not all facelifts are created equal. You've got to have an office facelift to offer some patients that don't want as much downtime, that
Okay,
want
we're
a
showing
quicker
pictures.
recovery.
Oh my
Here's
gosh.
some,
Oh, wow,
here's some
look at that,
examples
Kari.
of it right there, before and after.
Wow.
But these are great options for patients, but you have to address the underlying tissues if you want long-lasting results that will satisfy the patient both immediately after surgery as well as for the long term.
Now,
Yeah.
what are some of the benefits of this type of a facelift? Because obviously it's got to be very quick in the office.
Right, so there's great benefits. So first of all, being able to do it in the office saves you from having to go to the operating room. You don't need to have an anesthesia fee. You don't have to have a big facility fee at the hospital.
Right.
We can do this with patients awake. We give them some Valium to help take the edge off.
So they stay awake.
They stay
and
awake.
You're just kind of like relaxed, sedated a little bit.
There's a lot of talkesthesia during the case.
That's always fun.
So we talk with them a lot. The worst part about it is just getting numb. Got to
Yeah.
have a series of injections to get numb. But once they're there, we often will have patients fall asleep on us.
Oh, really?
Because they're that comfortable doing it.
So you do the chin.
Yeah, so
Get rid of the jowls.
as part of the procedure, we include in the MACSlift, is what it's called, submental or neck liposuction for all patients.
Okay.
And so that's included with the procedure. Another benefit is this is a short scar facelift. So instead of the long scar both in front of the ear as well as behind the ear, with this incision, we just go in front of the ear, and that incision hides really, really well.
It heals well.
It heals well, and with less tissue dissection that you do, there's quicker recovery, less to recover from.
Who is a good candidate for this?
Yeah, great candidates are patients with don't have necessarily real heavy, thick skin.
Okay.
So thinner, lighter skin, younger patients. This is something that a lot of our younger patients, it used to be that facelift patients, people only thought, oh, I've got to be 60s or 70s to get a facelift. And now we're having patients in their 40s and 50s
And
come
it doesn't just have to be women.
No.
Guys,
No, it
we
doesn't.
can go get them too.
That's exactly right.
Yeah.
So younger patients are patients that we're seeing a lot of. Patients that just have some mild to moderate amount of jowling or jawline things that
So
they
they
want to
just want
correct. It's a
lifted.
little bit of a what you would refer to as kind of a nip and tuck.
Yeah. Okay. And there's still the regular facelifts are still done too.
Absolutely. So
Sure.
that's the importance of getting in for a consultation
Yeah.
with one of us and having us really evaluate the face and tell you honestly, this is a good option for you, or maybe this isn't the best option for you, and we need to discuss the full traditional facelift.
But you do the full spectrum there.
Absolutely.
From facial care to
Hydrofacials, Botox.
which we love.
Yeah.
Yes.
If you have not
Love
had a
it.
hydrofacial, holy smokes,
You
it's
have
the
to
best.
go see Trish.
Yeah.
This is the new thing, and it's great for the skin. I do it myself once a month.
And you're radiant.
That's why you're
glowing.
amazing.
I hope so. I hope so. You know, the other benefit with the MACSlift in office is that we're often doing it in conjunction with other procedures to enhance the result. So
Yeah.
for instance, upper lid blepharoplasties, maybe a chin implant for certain patients just to enhance the result.
Oh,
Those
love
things
it.
can also be done in the office under just a little local anesthesia, and it really helps people.
I love the
People
fact
you
that you
trust.
make people feel as young as you do inside.
It's
on the
so
outside.
true. It's so true. Not only are you
Love it.
professionals and you know what you're doing, you walk in and everyone is so incredibly nice.
They
so
are.
we
They
love
are.
having you
They
here,
are.
Dr.
We,
Henstrom.
Thanks
we
for
love being here, so thanks for
Pleasure.
having me.
And how can people
Pleasure.
get a hold of you?
Well, they can go to our website, utahfacialplastics.com. That's the easiest. They can follow us on Instagram.
All your social sites.
All of our social sites are very active. They can see what we're doing and get a hold of us that way.
We love it. Thank you
Yes.
so much.